What is nitroglycerin? Let's start with the basics. Nitroglycerin is a medication used primarily to treat chest pain caused by reduced blood flow to the heart muscle. This type of chest pain is called angina. Nitroglycerin belongs to a class of medications called vasodilators. A vasodilator is exactly what it sounds like. It dilates or widens blood vessels. When blood vessels widen, blood can flow more easily throughout the body. Here's a simple analogy. Imagine traffic on a crowded highway. If the highway suddenly expands from 2 lanes to 6 lanes, traffic flows much more smoothly. Nitroglycerin does something similar with blood vessels. By widening blood vessels, it improves blood flow and decreases the workload of the heart. So, how does nitroglycerin work? Many nursing students memorize nitroglycerin without really understanding it. Let's simplify it. The heart requires oxygen to function. When coronary arteries become narrowed, the heart may not receive enough rich blood. This can cause chest pain. Nitroglycerin helps by first dilating coronary arteries. This improves blood flow to the heart muscle. Second, reducing preload. Preload refers to the amount of blood returning to the heart. When veins dilate, less blood returns to the heart. Then the heart doesn't have to work as hard. Third, reducing oxygen demand. The heart requires less oxygen as a result, and chest pain often improves. Here's an NCLEX pearl. Nitroglycerin does not directly treat the blockage. It helps reduce the heart's workload and improves oxygen delivery. So when is nitroglycerin used? Nitroglycerin may be used for stable angina, unstable angina, acute coronary syndrome, myocardial infarction, which is a heart attack, and certain heart failure situations. You will frequently see nitroglycerin administered in emergency departments, cardiac units, and critical care settings. Nitroglycerin can be administered several ways. Sublingual tablets under the tongue. This medication is rapidly absorbed. Nitroglycerin spray is delivered under the tongue. Topical ointment applied to the skin. Transdermal patch is also applied to the skin and provides a continuous medication delivery. Intravenous infusion. This is delivered directly into the vein or through a central line and used primarily in critical care settings. Here's an important nursing tip. For sublingual nitroglycerin, do not have the patient chew or swallow the tablet. The medication should dissolve under the tongue. Now let's discuss side effects. This is where many NCLEX questions are focused. The most common side effect is a headache. Why? Because blood vessels in the head also dilate, and that leads to increased blood flow, and that increased blood flow results in a headache. Other common side effects include dizziness, flushing, lightheadedness, hypotension, and weakness. Here's an NCLEX alert. If nitroglycerin lowers blood pressure too much, patients may become dizzy, faint, and unstable. This is why blood pressure monitoring is so important after administering nitroglycerin to a patient. Before administering nitroglycerin, always assess blood pressure, chest pain characteristics, and heart rate. One major contraindication involves medications used for erectile dysfunction. Examples include sildenafil, also known as Viagra, and tadalafil, also known as Cialis. Combining these medications with nitroglycerin may cause profound hypotension, and this can be life-threatening. Here's an NCLEX pearl. If a patient recently took sildenafil and is experiencing chest pain, notify the provider before administering nitroglycerin. What should nurses monitor? Assess chest pain. Monitor location, severity, and duration of pain, and whether that pain is localized in one area or moving to other parts of the body. If the pain is moving to other parts of the body, then it is radiating. You must also monitor vital signs and pay special attention to the blood pressure and the heart rate. Assess response of the medication after it has been given. Did chest pain improve? Did symptoms worsen? Watch for side effects, especially headache, dizziness, and hypotension. Let's apply what we've learned. A 58-year-old patient presents with crushing chest pain. The provider orders sublingual nitroglycerin. Before administration, the nurse obtains blood pressure. It is 86/54. What should the nurse do? The nurse should recognize that the blood pressure is already low. Administering nitroglycerin may worsen hypotension. The nurse should assess further and notify the provider. Let's summarize. Nitroglycerin is a vasodilator. It improves blood flow, reduces cardiac workload, treats angina, commonly causes headache, may cause hypotension, requires blood pressure monitoring, and has important medication interactions. And remember, whenever you think of nitroglycerin, think wider blood vessels equals less work for the heart. If this video helped simplify nitroglycerin for you, please like the video and subscribe to Clever Concepts Academy for more nursing school and NCLEX success content. Thank you for watching, and I'll see you in the next video.